Good evening, everybody. Welcome to today's space. I'm so excited to have you with us, and I'm very excited for this conversation. It's a very, very crucial one. And of course, I am going to be joined by three amazing panelists and the team at SEHAD. Very excited. Please do share this link in your Twitter feed, and forget to use the two hashtags that we are using to just drive the conversation further, which is hashtag safe and legal care. Just spell it out as you hear it, and the other hashtag is Global Gag Rule UG. I'm seeing some of our speakers already here. And again, I'm looking forward to us having this conversation with you. Thank you so much. Welcome aboard, Dr. Henry and Buki as well. It's so good to have you with us. And of course, I'm going to give a couple of minutes to just invite other people. But in the meantime, please do ensure that you have shared the link in your Twitter feed so that we get to have other people join in. This is a very crucial conversation. It affects each of us. And so I'm very, very honored to even be one of the people that is starring it, for us to know how have we, or how are we going to be affected? How are we already being affected by the Global Gag Rule? And in the meantime, I'm going to request for our speakers, in case you already have the mic, to please say hello, so that we can know that you can hear you. For those of us that have just joined in, everyone that is pushing the cause, thank you so much. We really appreciate your effort, and I'm really excited that, again, we get to have this really crucial conversation from a place of having panelists that are going to enlighten us, because most times as Ugandans, unfortunately, we usually wait for something to first affect us. And so very, very well excited that we are going to sit and talk through this one. In the meantime, as we give a number of people time to join in, like I said, the hashtags that are going to run this conversation, very, very important, are hashtag safe and legal care, spell it out the way you hear it, and Global Gag Rule UG. So I'm going to give just a couple of minutes for a few more people to join in, and then we'll start. But welcome. Thank you so much for giving us your time and for being here. Dr. Henry, can you hear me? Are you okay? You could just simply say hello so that we check that everything is running well.
Yes, hello to everyone. Hello, Mronji. Can you hear me?
Yes, loud and clear.
Perfect. So I'm already here.
Welcome. Thank you so much for keeping time.
Thank you.
Buki, thank you so much for joining in. I've sent you a request. Please do check for it. And the SEHAD team, whoever is going to speak on your behalf, or if you want to say hello, so we check and please, it's so good that you do this kind of work, but also that you involve the masses and do a great deal of raising awareness. Thank you so much for this opportunity, and for everyone else that is informing their followers. Thank you greatly. Hi, Buki, how are you doing?
Can you hear me? Hello?
Hi, Buki. Good evening. How are you doing?
Good evening. I'm all right. How are you?
I am well. Thank you so much. Thank you so much for making time.
Thank you for having me.
And again, just to check, Noor, I'm told you are going to speak on behalf of Sehad. Could you please say hello? So we do just a bit of checkup to ensure that we are up and running. We're going to be starting in the next 4 minutes, if that's okay with you. But for now, let's just check our connection to see that we are all here and can hear each other well. Over to you, Noor. All right, as we wait for that bit, I thought it would be a very good space to just bring us up to speed with what is the Global Gag Rule, how does it even affect us as Ugandans? For some of us, that might be the first time you're going to hear about it, or you may have heard about it in passing. But unfortunately, we live in a world where if the United States of America catches a flu, the whole world will definitely sneeze. And this is where this conversation and how crucial it is comes in. A number of times we look at certain things happening and we think, that's a little bit outside what I know, but unfortunately, something that was initially started out by the U.S. government later on rescinded till 2017, and then it comes back up on the surface, and now we get to see that after the Biden administration, we are seeing it coming back. The Global Gag Rule goes way back to 1984. And because we do know that the United States of America plays a very key role when it comes to affecting policies and shaping global politics and decisions, this conversation is very, very important because for a lot of people it might stop at just, funding. But today we seek to understand what is this gag rule and what should we as SRHR people that are involved in SRHR at a deeper level, but also as a normal Ugandan. How does this affect us? What should we look out for? What are the consequences? If you're sitting on a bike and your border guy is there and he has something to say, what can you tell him? Because I do believe that we are in a space where we need to also speak from an informed point of view. What are the statistics even looking like? Given the fact that the Ugandan constitution actually does criminalize parts of reproductive health rights like abortion, but yet post-abortion care is legal. So now that this gag rule has swung back into action, what are we looking at so that we can be alert and to prepare? Because I believe that this conversation is going to make sure that it's not all doom and gloom. How do we prepare? How do we disseminate this information to people in the islands, to the young girls in Barara? If in case you're well adversed with the news, there was a report that came out that Barara City is currently grappling with child prostitution, and we do know that abortions are not just procured by wayward people. Abortion is a healthcare right. So what does that even mean for us in this day and age? That's where the conversation is going to be started from. And again, I am looking forward to seeing where we go with this. Like I said, I'm going to be giving you a brief about our panelists today, but I need you to share the link for this space. Why? Because I believe that your follower definitely needs it. So just to give you just 1 more minute to share it in your feed and use the hashtags that we are running so that everyone else comes on board. But as we do that, I'm going to introduce our speakers. For the person at Sehad, I'm not sure why I can't seem to be able to add you as my co-host. If you may please send me a request, do go ahead. We all know that ever since Elon Musk took over this app, it's just really been one mess after the other. So you pardon me on that, but please do send me that request so that I could add you in case you are able to add more as we proceed. Ladies and gentlemen, my name is Faith Mulunji and I am an SRHR trainer. I am a feminist and a media personality. and I will be starring today's conversation. And you're not just going to hear my voice alone. No, I was just helping you settle in. We later on will be able to open up the space for you to share your thoughts, but you can most importantly do that in case you have any questions. You can do that using our two hashtags so that the conversation moves along. I would like to introduce you to our speakers for this evening, and I will definitely start with Nuru Nachibu Kamusisi, who is the Deputy Executive Director at SEHAD. And I'm just going to briefly touch on to what they do because their CVs they really speak for themselves. And I need you to know that we are comfortably going to be listening from people that know what they are talking about. I also would like to introduce to you Dr. Henry Kawesi, who is the co-founder and director Usawa Health Initiative Uganda. You are very welcome to this conversation, Dr. Henry, as well as Buki, who is the SRHR lead at Akina Mama wa Africa. I'm just still waiting a bit to be able to bring Noor on board. Like I said, ever since Elon Musk took on this app, a number of things are a bit hard to navigate, but don't you worry, that's not going to affect the quality of the conversation that we're going to have this evening. Now that the two are around, that's Henry and Buki, I'm going to set the ball rolling as I just fix a few issues here and there with Elon's app. And I want to start off by letting you know on something that you may not know about. And this is a coalition that came up to help us conceptualize what you need to know about the Global Gag Rule. And SEHAD, together with other partners in what is called the Coalition to Stop Maternal Mortality due to unsafe abortions, you could call them CISMOA. They came out in January on the 30th, to be exact, this year, and they talked a bit about this Global Gag Rule. And like I mentioned, it initially was started up by the President Ronald Reagan in 1980s, and we saw it pick up, and later on, as power changes within the United States in 2017, the conversation came back up courtesy of President Donald Trump. Now, this policy is also known as Protecting Life in Global Health Assistance, is something that the Republicans stand for. And we do know, or in case you did not know, that the party that has the power in the United States stars the ship differently as far as policies are concerned, and that affects us on an international level. So under the CISMOA, they released, they put up a report, and they were explaining why this Global Gag Rule is going to have very, very dire consequences, especially when it comes to SRHR, reproductive health rights of women, with things like authorizing medical abortions. And when you the work that SEHAD does, you do see that it is very important for us to actually get to know where does this leave us. We've seen the immediate loss of jobs as far as HIV workers are concerned. And so today, Nuru, Buki, and Dr. Kawesi are going to help us understand what this is about. So I'm going to start with you, Buki, as I wait to figure out how to get Nuru on board. Why should I, as an ordinary Ugandan, be on the lookout? Where does this conversation concern me? How does it concern me? Why should I be on the lookout for it? Just, the surface level of the conversation. Noor is going to join us in a couple of minutes, just a few seconds actually. Buki, why is this conversation important?
Thank you. This conversation is important. One, because as much as we all focus on national issues or local issues, we do live in what we can consider to be a global village. A lot of the conversations that we have are not in isolation. And so there's an impact on it. So, I mean, the one that has been the biggest conversation, and I'm sure we'll get into it, is that a lot of the work that is done around access to health, around financing, around funding does come from foreign governments, including the United States. And the United States is one of, or used to be, one of the largest donors in terms of improving access to health, especially access to sexual and reproductive health rights and services. And so this is an important conversation because it is going to have an impact in terms of services. It is going to have an impact in terms of laws and policies, and it's going to have an impact in terms of norms and the narratives that we have around understanding what is sexual and reproductive health. And it's going to challenge some of the ideas that we have already. So it's important because it is part of a conversation that has been happening for a while. And in many ways, it has been dominated by the United States for various reasons, which we can get into. And so there's no way we shouldn't be part of this conversation because it's very important for us because it affects us. It goes to the root of some of the work that we do. So it's quite important to be very knowledgeable about it. The second reason is that there's a lot of misinformation around this issue. We've been seeing a lot of what could be considered to be conspiracy theories, to be half-truths. We've seen what would be considered to be even sometimes outright lies around these issues. And because there is a lot of, moralizing around this particular issue, it often is very difficult to tell what is true from what is half true, to what is completely untrue. And so in many ways, this has become an ideological battle over, decision making, over bodies, over ideas, over understanding of what we mean by healthcare, over understanding of who should make decisions about this. And so it's quite important for us to be able to have this conversation so that people do understand what is at stake, but more importantly, to be able to get the information so they can make the decisions on their own, but they can make it from an informed perspective that is not necessarily just trying to shift their understanding of it, but really helps them to get to the root of the issue. And then based on that, they can then decide on which side do they fall, or which or how they understand the issue. So I would say for me, those are the two things of why I think it's important. There's many more reasons, but I think right now in the time that we're in, because of the uncertainty, because of the amount of information we've had to process in the last couple of days, and for a lot of people, they're also not aware of the historical precedent of this issue, that this is not a new issue. It did not start yesterday. It did not start when President Trump became. They're just joining the conversation now, so they're not sure about, which information is correct, what to believe, what to understand, who to listen to. So I'm hoping that through this conversation, people are able to understand what is going on, and then are able to have the clarity they need to actually understand what is going on and how we actually need to respond to these times. Over to you.
Thank you so much, Buki. I'm actually really glad that Nuru is finally here with us. You are very welcome, Nuru. How are you doing?
I am well, thank you. How are you?
Thank you so much for making time. I am well, thank you. So let's start from the very, very beginning. I could just briefly point out aspects about the gag rule, but please do inform us, what is this gag rule? And you could also go further into what are the implications? What aren't we even seeing? What is going over our heads about this gag rule? Thank you so much.
Thank you. I'm excited to be speaking to us this evening. So first, I wish to state that the Global Gag Rule, in my view, is an example of the influence that American abortion policies has on reproductive rights in the whole world. This gag rule comes in to deny women their right to access abortion across the globe. And the gag rule requires that non-government organizations that have been receiving funds from the US and the providing and advocating for or refer to abortion services are gagged. And the gagging means that they are stopped from speaking, they are stopped from providing the services, they are stopped from doing what they are doing. And other people call it the Mexico City policy. It ideally comes in to prohibit any U.S. Health aid from providing, from referring for, advocating for abortion services, regardless of whether the funds are from US or not. So this rule is not coming up for the first time. This rule is said to have been around since around 1984 when the US president then, President Ronald Reagan, at a conference in Mexico City, enforced that these services would not be provided. And ideally, it is really just implemented in an attempt to control women's bodies and choices and limit their access to essential reproductive health care services. So this has, there's some bit of evidence to the Global Gag Rule that when you restrict abortion services, it doesn't stop abortions from happening. And I think America needs to know that by coming up with the Mexico City policy, it does not take away people from accessing abortion services, but it rather makes them to actually take them in an unsafe environment. And this is most likely going to lead to very bad indicators in the area of maternal health in the country and worldwide. I also think that it's a reminder to us that the fight for reproductive freedom is far from over and above the policies like this particular one, which comes in to harm women, especially women in marginalized communities, women is with no voice, women with no one to speak for, because it gags the ones that are speaking for them, but also gags the ones that are providing the services. It kind of overrides our national legislations, if I may state, and it is a harm to us. Now, after 1984, the very first time that President Trump became the president of the US, one of the things that he did was again to reinstate the Mexico City policy or the Global Gag Rule. This time round, or then, requiring that all non-government organizations that were receiving funding then had to sign on to an addendum to indicate that they would not be speaking about abortion, they would not be providing family planning services, they would not be providing abortion services and all that. At that time, the governments were not impacted upon. And it was a threat to healthcare at that time. It is one of those rules that he has again come back with. This time round, gagging, not just abortion, but provision of other services, critical services that are key to the communities and populations of the world, including Uganda. And these services extend as far as HIV, TB, and malaria. So when you restrict contraceptive use, when you restrict people from speaking about access to abortion services, it has wider implications. It could be worse for Uganda because Uganda's legislation around access to abortion services is a bit unclear. First, we have the Penal Code Act. We have the Constitution that indicates that we don't have the right to terminate life of an unborn child unless authorized by law. But we also know that we have the Penal Code Act that has both provisions that are both restricting but also allowing access to abortion services. Of course, if you ask me if we have a law on regulation of pregnancy in the country, I would say no, because the Penal Code Act is a 1950 legislation as amended, and the Constitution is a 1995 legislation. And I know that amendment of the Penal Code Act requires that we actually do a lot of more advocacy for these particular sections of the law that actually restrict. But that Penal Code Act is not actually a law on regulating termination of pregnancy. It is a legislation that provides, or offences and their penalties. So if it is intended to provide offences and penalties, then it has a section that actually provides for instances within which abortion services can be provided. Then it's not a law that is meant to regulate termination of pregnancy. That said, and why I'm saying the Global Gag Rule is even worse for Uganda is because that penal law has 3 particular sections that actually restrict access to abortion services, right from a woman to a service provider to a pharmacist. But the same legislation has sections that actually provide that it is not bad to provide a service if it is provided in good faith with reasonable care and skill, and considering the woman's state at that time, then a service provider will be providing it. Why it is worse for us is because abortion services are ideally meant to be provided by expert health service providers, but the wider implication comes back into service provision and the bit of allowing women to choose and make a choice onto what they want to do with their bodies. I want to indicate that, and I'm starting from the national level so that we understand, Uganda has a constitution that allows service providers to practice their profession. So if Trump or President Trump stands wherever he is and indicates that we cannot do providing services on contraceptive use and abortion services, he's in one or another overriding the national legislations that provide that service providers have a right, professionals have a right to practice profession. So that is one of even the impact of how far it goes. But also Uganda is a party to various international legislations that it cannot run away from. And some of these include the African Charter on Human and People's Rights and the Rights of Women in Africa that requires that we take appropriate measures to protect the reproductive rights of women. So with a country like Uganda that is far below the WHO targets in terms of maternal mortality, the bigger implications of the Global Gag Rule would actually stem into making our indicators extremely bad. We are at the moment celebrating 189 deaths out of 300,000 live births. And a bigger percentage of this, which is I think about 18 to 20, is a contribution from unsafe abortions. This target, as we have the Uganda Demographic and Health Survey, this indicator is extremely not the best. I know we stemmed from 336 to come to 189, and we appreciate the steps we've taken, but the Global Gag Rule will take us back. Ideally, we would have celebrated if we were at 70% as per WHO indicators, but we are at 189. Now, this 189, to reach this, it means that people have done a lot of work to empower women into contraceptive use, into information seeking, into changing seeking behaviors of health services, but also service providers to provide the service. The pulling of funds away from Uganda, coupled with the gagging of speaking about unsafe abortions and providing the services, is most likely going to hit hard onto Uganda, and chances of us having better indicators would even be worse. We know that there's a lot of harm that has come with cutting of funding with the Global Gag Rule for women and girls worldwide, and there's a big threat to reproductive rights, and there's a lot of fear created within communities and confusion in terms of where to access services. Why? Because the partners that have been providing contraceptive and abortion services have actually been gagged. Why? Because the funding has been cut. That means that partners that have been in the country and extending services to the communities will no longer provide the services. The government health facilities, even if funded by just the government, are not enough to provide the services. Already we are struggling with the doctor-patient ratio. So tell me how you expect a health service provider who has been seeing, for example, 50 women delivering in a day will create time to actually speak to a young person that just needs information about contraceptive use. It's going to be very difficult. It means information provision, timely information to people, but also services will actually be struggling. The other impact, if I may say, will be the broader implication on choices of women. Women have been empowered as we speak to actually come up and indicate that they can do spacing of children and could go to facilities to access family planning services. Now, with this global gag rule coming through, it ideally means that the choices of women are going to be impacted upon. First, because the services that have been closer to them are pulled away, but also because the women might get back into the confusion and fear that comes with the global gag rule. I've already had a conversation around health service providers not being able to provide the services because it impacts on their provision of practice of profession, but the comfort and confidence that we had created with them to actually provide the services to the women in their comfort is going to be impacted upon. Just like in the area of HIV, where we have been having conversations around stigma and chances of stigma and discrimination stemming up, it's also going to be likely that women accessing services on abortion and family planning are going to be stigmatized more. Why? Because our community integration strategies as Uganda today are requiring for integration of services. Initially, we have had, for example, art clinics, youth corners, and all that, but these are all going to phase away with the global gag rule. The indication would ideally mean that women are lined up, for example, under OPD, to one have coming for an antenatal, one coming for an abortion service, one coming for family planning service, one coming for HIV, will all be commingled into one space and seeing one health service provider. So access to services will be stigmatized. I want to tell you that we are coming from conversations where we would empower health service providers to remain be professional and not provide information of clients to people they meet. Just imagine that we have created that comfort and women would happily go into the facilities to seek family planning services. And without these services being provided in their comfort, it means that they're going to line up. And questions of, oh, I found Nur on this line. What are you here for? And Nur wondering whether she'll ever come back to this line to receive a family planning service or are going to be seen. So self-stigma and community stigma is one of those bigger implications or impacts of the global gag rule that we'll actually see. We know that it undermines rights. I've already spoken to rights, and the impact is that women's rights, girls, pregnant people, and communities that are disproportionate are going to be affected upon. With already a system that is marginalized. So duties of providing comprehensive services to patients are going to go away. While preparing for this, I read about the impact of the Global Gag Rule, and I've seen one of the partners called the International AIDS Society warning that when the Global Gag Rule is reinstated, it's going to have dire consequences to the HIV response in the country, and especially in countries that are low and middle income. And Uganda is one of those low developed countries. So implications on HIV response are going to be hard. And I've already had a conversation around the impact on maternal mortality. And beyond that, I think we had reached a level where our lovely government is open to having some of these conversations, given the implication to the healthcare system. I feel like the healthcare system is going to be weakened further with this particular global gag rule, and it therefore means that spaces like this are important for us to sit and reflect onto what we should actually be doing so that we understand the implications, get back to the communities and speak to them, but also most importantly engage the duty bearers on the likely implications of this so that we have concrete conversations and ideas on to how to support women. Thank you.
Thank you so much, Nur. You extensively explained this. Thank you so much for taking us throughout that journey and just giving us a broader perspective of how this is going to affect not just women's reproductive health rights, but also the receptiveness or how willingly women will be able to come and even access these services. I really do appreciate that. I am going to ask you to mute your mic, and I'm going to hand the mic to Dr. Henry Kawesi. Nuru spoke about the doctor-patient level ratio. She also spoke about the fear that has been crippling within the SRHR movement as far as the milestones that we had garnered before. So far, the government being able to, having started being slowly adjusting to these conversations being had, we see SEHAD sometimes engaging even with religious leaders. As someone that is a practitioner, from your experience of providing health services to communities, help us understand how this policy has affected reproductive health services, especially, family planning, among others. Because we've heard from Nuru, we've also briefly heard from Buki, but as a doctor, what have you seen so far? And where do you think we need to go from here?
Okay, thank you, Moranji. I hope you can hear me.
Yes, we can. Thank you.
Good evening to everyone. I listened to Noor, and she actually explained a lot of things extensively, but from the view of a health service provider, the GGR has affected us in very many ways, and I'll divide this into two. I'll look at HIV and I'll also talk about reproductive health services at large. To start with, the GGR has affected or has caused a lot of disruptions in HIV stroke AIDS services. Recently, we saw tweets, we saw articles in news pointing out that some clinics have been closed, though that wasn't the case. What the government had done was to integrate most of these clinics into the other OPD clinics, just as Noel pointed out. But the rumors and all the fear that was caused by this policy has resulted in two patients skipping doses because they want to plan for the future, given the uncertainties that have been caused. Some want to prolong their supply, but this is going to affect their adherence, but also in the long run it can result into resistance of the virus to the available regimen. The other thing we've recognized in the service provision is there's been decline in HIV testing services. The uptake is becoming low because people are worried if they keep testing and someone turns out positive, given the uncertainty about the provision of the medication, what happens? So there's been hesitation and also low uptake of these HIV testing services. What we've been doing at the clinics is we've been using a strategy known as the MMDR, that stands for multi-month drug refills, and we've been allowing these HIV patients not to take drugs for 2, 3, up to 4 months. But with such a foreign policy in place, we might go back to giving patients 1 month refills. However, that the MMDR had its own advantages. In so doing, if a patient could take a 4 months refill, that means that could help a patient cut the transport costs, but also improve their adherence, given the fact that this patient is having a lot of pills at home, they can keep taking. But if we go back to the 1 month refill, that means this patient will need to come back to the clinic every month, but also their supply is shortened. So it affects, one, the patient in their finances, but also it affects the adherence of the patient to the drugs. And then after the GGR was passed, we saw a few days later, PEPFAR was given a waiver. But again, if you look at this waiver, PrEP and PEP was only supposed to be for pregnant and breastfeeding women. For those that don't know, PrEP stands for pre-exposure prophylaxis. It's some kind of drug. It's medication. It's just pills that we give to people at risk of getting the virus. And then PEP is post-exposure prophylaxis. That is medication that we give to people who have been exposed. PEP has two formulations. You have the pills and you have the long-acting injectables. So this means if the funding for these pills has been cut off and they're only providing for the pregnant and the breastfeeding women for these 90 days, as Trump is reviewing whatever documents he wants to review, we are standing a risk of increasing new infections. because we are not sure if our government can cater for all these pills for the PEP and the PrEP. And the other thing Noor pointed out, which I like, was stigma. Currently, we are doing service integration, but you imagine a patient standing in the line with a hypertensive, a diabetic patient, a malaria patient, and then for them, they are coming in for pills, others asking for abortion services. So it is going to increase the stigma around most of these issues, things to do with people living with HIV. But what people need to understand is stigma affects the mind of the patient. And the mind, as something part of the brain, it controls all your body functioning. If the mind is sick, there's no amount of pills that can fix your body. That's one thing people need to understand about stigma. So if these patients living with HIV are stigmatized in any way, whether it's self-stigma, whether it's community stigma, the pills won't be of any hope. So before we look at the pills, we need to fight this stigma around this whole issue. Then talking about maternal health, things like family planning. Again, we pointed out our current maternal mortality rate is at 189. And yes, she said we came from 336, that was in 2016. Currently, we are standing at 189. But our SDG goal, or the commitments we made to UN, was to cut it up to 70. Now, with all these disruptions caused in contraceptive supply chains, you had the big organizations like Marie Stopes, RHU, have paused some of these outreaches they are doing in the rural areas. The effect of the policy currently hasn't been felt in the urban settings, but if you go down to the rural areas or the hard-to-reach areas, it's a mess. So pausing these outreaches and then disrupting the contraceptive supply chains, all these can result into increase in unintended pregnancies. Statistically, in Uganda, we know that 44 teens get pregnant per hour, 44 teenagers. And that means with the policy in place, that will get worse. So the increase in unintended pregnancies, again, will point to increase. Most of these unintended pregnancies will result into unsafe abortions. And we know that unsafe abortions are the biggest contributors of maternal mortality. So remember, we're at 189. With such a foreign policy in place, we risk going higher than that, or even bouncing back to 336 that we had. Uganda is one of the most fertile countries. Our ladies at 4.4. Our total fertility rate stands at 4.4, and that means on average, every woman can get 4 children throughout their reproductive ages. If you look at the other neighboring countries, Uganda is having the highest. The others are around 3.3, 3.2. Uganda is higher than Tanzania, higher than Kenya, and higher than Rwanda. So if you have these disruptions in contraception, then we risk having a lot of unintended pregnancies. And as I've just explained, this trickles down again to increase in maternal mortality rates. Briefly, that's what I can say. Over to you, Moronji.
Thank you so much for your submission, Dr. Henry. Buki, I hope that you are still with us. And as my next question is to you, because I am thinking from a space of is it possible for us to fight back, and how can advocates fight back and mitigate the impact of this global gag rule? Noor and the doctor have extensively explained what is at risk, what is already happening. Is there a way we can ensure that we do not lose out on the milestones that we had already registered within the SRHR movement? For instance, Uganda has a goal to end AIDS by new AIDS infections by 2030. With this gag rule, can we be able to fight back and ensure that we do not lose out on the fight against stigma, the awareness that we've been raising, and the few wins that we had registered as a country?
I think that's an important question. And there's a part of me that feels deja vu, right? For many of us who have been in this space, this is not new. We go through this every Republican government that comes in, which happens all the time. And so when a Republican president comes into the United States, we see a reinstatement of this Mexico City policy, which is also known as the Global Gag Rule, as we understand what that gagging means. And so when Trump first came into power in 2017, which he expanded it, as New has mentioned, many of us had these same conversations about what does it mean for the continent. At the time, it didn't really impact our governments. It was starting to impact some of the UN agencies that support governments to be able to achieve some of those goals that have been mentioned in terms of eradicating HIV, addressing gender-based violence, and dealing with reproductive health. And so we understood that it did not affect government.
Dr. Henry and Nuru, are you able to hear Buki? I unfortunately can't seem to get her.
No, it's breaking.
She's breaking? Okay.
But
All right,
had
let's just give her a couple of minutes. Buki, can you hear us? Your internet is breaking a bit. All right. Unfortunately, Buki's connection is a bit shaky. Let's give her a few more minutes to be able to reconnect. Buki, as you get back in, I'm going to come back to you, Noor, just to point out, still the same question. How do we ensure that we do not lose out on these wins? You've talked to us on a policy level. You've also explained extensively how do we safeguard, how do we fight back, what does that even look like in a country where about over 80% of our Ministry of Health budget is foreign funded. What does fighting back as advocates look like in your case as we wait for Buki to return?
Thank you so much. I think first is we need to actually understand that beyond the politics, the bodies are ours. It is our bodies, and we need to make decisions regarding our bodies. If you wake up in a day and you don't want to have sex, there's no reason why you should be having sex. If you woke up in a day and you don't feel like getting pregnant, there's no reason as to why you need to get pregnant. So self-empowerment is what I'm trying to speak about first. It's the only way we can fight back is to first of all do self-empowerment us, and also extend this self-empowerment to the communities that we serve. That would actually ideally mean that people are able to stand up and indicate that it is me who is affected at the end of the day. It is that woman that will be in the labor ward year in, year out. But we also know that it is this woman in the community that is going to be the breadwinner in her home. So self-empowerment is key. But secondly, that some of these services can only be provided by the people that lead us. I keep telling people that when we vote government into power, we actually sign what we call a social contract. a social contract where we have to hold them accountable for the services that we should be getting. So good enough, we are going into elections and we'll vote another government into power, or the one that is available into power. So we need to get back to have conversations with the government to the realities, to take away, put aside our religions and cultures, to actually indicate that abortions are happening in this country and that they're killing women. Many of these are happening in communities, and ask yourself, if they have been happening in communities with all these services available, how about now when we are gagged? What will happen? So we are going to get back. One of the recommendations that I'll give is that we need to get back to our governments to actually paint a picture. It would mean that we have to do some bit of work into research and what is availed. We are glad that we have the UDHS that speaks to some of these things, but we also know that the Guttmacher Institute has been providing some of these statistics. We know that SEHAT has done some of the research that indicates that in Wakiso, Kamuli, and forgotten the other districts, teenage pregnancies and unsafe abortions, we have a retrospective study, are actually happening, especially among the young people. So with all this that has happened, it is high time that Uganda thought about its legislation, which is the Penal Code Act, to remove provision of abortion services from criminal provisions. There's no reason why we should be criminalizing some of these services. And I again keep saying that criminalizing services does not mean that they will actually not happen. It ideally means that the practices will happen. Quick questions of how do you bring people together to actually ensure that these do not happen. So concrete conversations with the government line ministries to actually show the need so that we inject part of the money into the health service provision. The other week I was posing a question to say, while Trump was recalling all these services and bringing back the Global Gag Rule, pulling US from WHO, pulling away services, HIV, malaria and TB, Uganda was passing a supplementary budget to construct a health facility, Lubowa Hospital. But would it have come that fast, or would we have sat down? And we're not saying we shouldn't pass the budget. No, that's not what I'm saying. I am saying, what should we be prioritizing as a country? Can we sit down and reflect and say, okay, with lack of family planning services, who is going to be impacted? It means that more women are going to hit the health service, the health system, and the health system will be struggling. Is it the time for us to even think about the so many districts we have and how much money goes into districts? Is it the time that we actually want to think about the so many members of parliament to actually ensure that some of this money gets back into services? Is it the time for us to think about the tax that we collect from people and where we channel it to? For me, these are concrete things that we actually need to do to fight back. But also, too, we need to think about localization and ensuring that local funds get into areas that they need to go into. The time is now for us to hold our governments accountable to prioritize our healthcare system. We have done well as a country, but we know we've been doing well with support from partners. But we need to start to critically think and engage our ministries to actually know that the people that are impacted upon are people that are coming through. It would be very nice if we see the people that are standing for different positions in the upcoming elections speak about health as a priority, sexual reproductive health as a priority for the people, access to family planning services as a priority, and ensuring that women access abortion services when the need actually comes. Thank you.
Thank you so much, Nuru. Buki, are you back? Can you hear us clear now?
Yes, I'm back. Can you hear me? Internet is terrible.
Yes. So what I'm going to ask you to do is combine your response, but you could also go into what SRHR advocates on the national and grassroots level can do to ensure that, there is enough political and public support for women's reproductive health rights. Because Nuru has also urged us to first take personal initiative and then, ground up sort of approach as individuals, as a community, but also as people that elect leaders. How do we then hold them accountable? So for you, I want to hear from that perspective to just add on to what Nuru had already submitted. Thank you so much.
Thank you so much. And apologies for my internet. I was talking and didn't realize that I had dropped off. But I think I completely agree with what Nu has said, is that we have to shift the responsibility back to our governments. That is one critical thing. But I think another really important thing that is necessary for us to talk about, and that's important, is for us to think very deeply about why people like Trump are coming into power. Right? It's because they believe these things. When people think that, oh, access to abortion is meant to destroy families, or when they believe narratives that say that the money that USAID is getting is actually going into the pockets of organization and it's not actually going to help people, it's only benefiting a certain group of people, and they believe all of those stories and they believe these conspiracy theories. That means that as a society, we're in many ways regressing. Uganda has been known for the powerful HIV campaigns that they did, and being able to, reduce HIV and being able to understand it and dealing with issues of stigma. The same is necessary when we're talking about these issues, for people to understand why it is so critical and so important. Because people believe that nobody has a right to health. We see health as a good that can be paid for, that can be bought. And so when we're talking about abortion or we're talking about access to HIV, there's now this shift to blaming people and stigmatizing people. And you're seeing that language very heavily on social media, but also in conversations that you have with people who are now using it to confirm the bias that they have. So I think we have a lot of work as advocates to really be able to use the language people understand, to be like, actually, let's sit down. This is actually about saving lives, right? This is about making sure that we all are able to live the kind of lives we want to live. Health is so important for you to be able to move around as a person, to be able to design the kind of life you want to have, to be able to make the kind of decisions that matter to you, to be able to kind of have good relationships, good partnerships, to be able to have strong communities. And if we destroy these connections that we have as human beings, if we now become people who believe that people should die because they have HIV, if we're the kind of people who believe, no matter what our belief systems are, we believe that young women should die because they're able to get access to reproductive health services, that we no longer trust our health professionals to be able to do their work or to carry out their oath, and that people like Donald Trump, who are they in power, but they're spreading very, very divisive messages. They're spreading very harmful narratives that is rolling back the effort that has been done by so many. I think many people have forgotten that, to be able to access these HIV drugs, it required people, especially women, remember South African women, who put their bodies on the line to protest, to ensure access to ARVs. They fought. They were the ones taking care of their communities, of grandmothers who were stepping in to be able to make sure the, kids who were orphaned were able to have access to food and were supported and stepped in the gap of their communities. If we have to fight that struggle again, will people step in the gap? And so as advocates, we really need to think deeply. Yes, people need to be able to ensure that the government carries out their role, but we as people also need to step back and start listening to what it is that we're saying and what it is that we're believing around these issues, because it's based on that people like Trump can get elected. It's based on that we can see people, using hateful words and hateful narratives on social media or in the news or even with their family and friends. So I think it's very critical to do that. The other thing that as advocates, I think is like, we actually need to be able to read between the lines. A lot of what Trump is doing is fear mongering. He's signing executive orders and doing it at such high pace, right? He's making sure that people don't have time to even understand what exactly it is happening. So there's a lot of fear of, oh no, he's doing this, so we need to stop. He's doing this, we need to stop. And I remember there's a man who's an historian. His name is Timothy Snyder. And he had written something in 2022. And that stuck with me, and it's so important. And that's also something when some of us studied the first GGR under Trump, we realized that people did not read the fine print. A lot of people were doing what Timothy Snyder called obeying in advance. So they knew that Trump did not like this. They knew that Trump was pushing back against this. And so people immediately just obeyed. Nobody really was taking a step back to be like, okay, what is this about? Do we need to obey? Can we do civil disobedience? Can we put people before authoritarian figures? And so it's quite important for us as advocates to really start to say that we don't need to obey in advance. Let it be clearly stated out what actually is happening. Let them exactly say that, yes, they want people to die. Let them be the one to say it so that it's clear that that's what's happening. But we need to be very careful because that's what we were seeing civil society do in 2017. They were obeying in advance, in terms of just what was in the GGR. Because there are exceptions within GGR. It says you can't save the life, right? In cases of miscarriage. We know our countries, you can get post-abortion care. But yet what was happening is that people were literally not providing any kind of care, any kind of service. And so we have to say, don't obey in advance because you still have to provide those services. You still have to ensure that that can be done. And that's something that our governments can do. That is something that we as organizations can do because part of this is also to ensure that we are able to be responsible and accountable to the communities that rely on us, to those in whose name we call ourselves advocates. We don't do it alone. We do it in community with so many people who have entrusted us with their stories, who have entrusted us with their trauma, with their pain, and we owe it to them to stand in the gap and to be able to say, no, we will not do that. No, we will not obey in advance. You're trying to scare us. You're trying to change what has been a global order that we have been trying to shift towards progress, towards justice, towards peace. And just because you, as an authoritarian figure, want to come in and want to be, want to be a king. And the truth is, as Africans, this is not new to us. We see this in our countries. It's very evident to us. We have lived under this kind of tyranny and under this kind of dictatorship for a very long time. For many of us, we've lived in it for our entire lives, right? So it's quite important for us to take those lessons of what we've learned to live under a tyranny, of what we've learned to live under a dictatorship, and start to bring it together and start to have really deep conversations. Because as much as this is a big problem right now, it's also a really big opportunity for us to come together and to think deeply, how do we support each other? How do we support our communities? And how do we ensure that our governments actually fulfill their responsibility to us? And how do we as people fulfill our responsibility to each other? I'll stop there.
Thank you so much, Buki. That has been well elaborated. I want to bring back Dr. Kawesi for, I want to hear how and what can be done to ensure uninterrupted reproductive health rights, amidst the pushback that Buki and Nuru are talking about. What does that look like? How can we ensure that we are taking care of our people? Because we deal with the repercussions almost immediately. We are the ones that stand at a risk of losing more lives. So please do chip in on that. But I also would like to let you know, as Dr. Henry comes on board, that we are going to open the space for you to share your comments and your remarks. For you that has probably just joined in, we have 2 hashtags that are running this conversation. Should you just want to be part of the conversation, the 2 are safe and legal care, but also don't forget to use the hashtag Global Gag Rule UG. Doctor, over to you.
Thank you, Moronji. We've talked about how we ensure uninterrupted services amid this foreign policy. One is what the government of Uganda is already doing. We are doing service integration. And we are looking at moving these specialized clinics that are to do with HIV and then mix them up with other clinics that run chronic diseases or chronic patients. Though that also has its downsides, as I've just noted, that mixing up these patients creates room for more stigma. However, the other thing we can look at is investing in technology and digital health. Currently, we have a lot of apps, a lot of them that provide sexual and reproductive health services. But the thing is, down to the communities, people don't know anything about them. So we need to create more awareness and also educate our communities on how to use some of these apps, because right now with pauses in outreaches to the rural areas, these can be of help. We have e-pharmacies on some of these apps, e-pharmacies that can provide some of these pills, things like abortion pills, to the communities. And we know that some abortions can be done from home. So telemedicine or apps can be of help in this case. But again, the other thing we can look at is building and enhancing the capacity of some of our health workers, especially in the rural communities. We have the village health team, or what we call the VHTs. We have the nurses in the health center 2s, health center 3s. If we can build their capacities, then we can be sure that these health workers can manage patients at their level. They can provide contraception, and at best they can also provide post-abortion or comprehensive abortion care. That is it. Over to you, Moronji.
Thank you so much, Dr. Henry. I have one more question for both Nuru and Buki, and then we'll open up the space for you. So in case you'd like to speak, please do send in your request. But before we do that, please allow for me to recognize a number of people that have joined us on here, each and every one of you in your different capacities. Thank you so much for keeping us company this far. But please allow for me to specially recognize Dr. Roslyn, who is an official from the Ministry of Health. Thank you so much for being part of this very crucial conversation. I'm seeing Akina Mama wa Africa. Thank you so much. I saw Farmfort earlier on as well. These are also organizations that together with SEHAD are doing the amazing work of ensuring that SRHR movement in Uganda at the grassroots level is doing really amazing. I also would like to recognize SRHR Alliance UG, Tahi Uganda, Women with a Mission as well. Thank you so much. Hope Vine and every single person that has spared time to hang with us this evening. So please, in case you have a question, you can feel free to actually either use the hashtags, just like what Dr. Chibidige has done. And Dr. Chibidige says that in order for us to fight back, we need to extensively build the capacity of local organizations as well as health systems that are self-sustaining and resilient. He also suggests that we need to cut on our appetite for external funding, especially as far as sustainability is concerned. He suggests that this must also be coupled with funding diversification so that we do not have to lament over other people's taxes. Thank you so much for that contribution. And thank you so much, Mungadi, for your response as well. Kitandre Rodney is amazed at the statistics that 44 teenagers get pregnant every hour. Agren Shekanabo says that a woman's period must be missed by choice. How about if the period is missed as a result of rape or sex with a relative or a brother? Shouldn't the lady have access then to a clinic in abortions clinic abortions that is safe? We also have Grace Namataka, who thanks Buki, and she thanks Buki and also says that she emphasizes the need for more hope-based narratives in confronting retrogressive or regressive policies. Thank you so much for everyone that has taken part in this conversation. Now, for my very last question for Nur and for Buki, I would like to hear from you. This one you can answer jointly. How do you suggest that local organizations secure sustainable funding, especially for reproductive health, especially in this current environment? What are some of the ideas, since we are thinking and re-envisioning together? I will start with Nuru, and then we'll have Buki next. Thank you so much, ladies.
Thank you so much. I thought we'd start with Buki. Well, I want to think that institutions have got to think through business engagements so that the businesses are plowed back into providing services to people. Our legislation, which is the Non-Government Organizations Act, does not stop non-government organizations from carrying out business. That's one that I could think about. But also, too, we may want to now reach out to countries, continents that are against the Global Gag Rule so that we intensify funding and also provide support to ourselves. While America is against, I'm sure there are other continents and countries that can step in and ensure that we have sustainable funding for the work that we do. The other would be to get back to communities and think with them, think through how we are able to support ourselves to maintain the services that we are getting. This I know that I've been in countries like Zimbabwe where a whole community has actually constructed its own health facility. So it means that there's local funding within the communities that we could be calling givers, the people who can give within the communities, those ones that believe in philanthropy, to actually see through how we support each other. For now, that is what I can think about. Thank you.
Over to you, Buki.
Okay, thanks. I agree that we definitely need to start thinking of this, but I'm also just thinking of organizations like AWAC who have already been thinking in terms of, access to the communities that they work with. And one of the things they have been doing is seeing if they can include livelihood components in their programming. So yes, we know we are working on sexual and reproductive health and rights. Yes, we know we're working on access to HIV. In those safe spaces, are we able to include saying livelihood so that people can actually afford to access some services? I mean, I think those are those kind of ways we have to start thinking about. I think for so long, also because of the donor environment, we've been thinking in terms of single issues, and we've been thinking in terms of only providing people, we only do SRHR. We don't think about economic justice. We don't think about livelihoods. But I think now what is challenging us is that we do, as Noor said, need to think with communities about those needs and how we can integrate different aspects of this work to be able to ensure that the women that we work with, the communities that we work with, are able to sustain themselves, are able to have autonomy, especially in terms of the economics, and are able to access those services themselves, and are able at the local level to be able to hold their facilities accountable in terms of accessing healthcare, or even being able to access, information, as they said, either like through digital apps, but even just sharing information at the community level as well. I think we do have to build from there. That's very critical. And yes, about that business development ideas, I do think that we are not businesses as NGOs and advocates, so it's going to be difficult, but we do need to think of the ways in which we can sustain ourselves, either by us leveraging on local philanthropy, because the truth of the matter is that we know that as Africans, we give, right? That's just the truth. When you're doing kwangalas and all of those things, people come together and they raise that money and make sure you can have your wedding and your events, and you do all of those things. When somebody's parents is gone, we all contribute and start to provide support and things like that. So we can think of that and start thinking of, we are philanthropists. We do give. And we can start investing in things that matter. to start thinking of ourselves as that, because when we think of donors, we only think of these bigger donors and the rights and the proposals. But I think it's quite important for us to also start reflecting on what we mean by philanthropy, what we mean by donors, what we mean by communities. Because trust me, if it was only up to donors, honest money, we wouldn't be able to get to where we are right now. We wouldn't have the rights that we have right now. We wouldn't have the opportunities we have right now. So I think it's also quite critical to start thinking back and going back a little bit deeper to our roots and to our indigenous knowledges of how we were able to sustain life, how we were able to sustain communities, and what we can do, and then use this process as it's changing to be able to create opportunities to think of those strategies and be able to implement them. Thanks.
Thank you so much, Buki. I'm stammering because you have explained this very extensively, but also in a sense that you're giving us hope that this is possible. We can be able to, to pick up from wherever the donors may be wanting to stop. And thank you so much for shining a light on this being possible. So I'd earlier on asked for our listeners in the audience, in case you have a question, some remarks, so that you can share. And I'm going to give opportunity to W Mungadi. That's your Twitter handle. Please do share in a minute. If I do not have any other requests, I will read some of the comments and then give my panelists, chance to give their last remarks. But over to you, Mungadi.
Maybe if there's no other person to pick the microphone, he'll give me 2 minutes. Good morning. It's 9:17 a.m. in the US where I am. Good enough, I'm a Ugandan who has served both continents. And today in America where I am, we are having temperatures of -30. So schools have not even opened. But one of the things that I've seen this morning, because I have kids who go to school, the school brought food at home. That's a school feeding program for children. Why am I saying all these things? One, I knocked doors for Trump. I knocked doors for all these fellas you're talking about. And I called it a protest vote because of what I was seeing in my own country. By the way, I worked with the CDC at home. And I used to criticize CDC. That the money that comes from America was supporting themselves. They pick money from America and they use it at that level. My goodness, Africa, let's start thinking. A country under snow for 6 months has to support us who have sunshine today. If you're a Ugandan and you're listening to me, tell this panel here our priorities. Tell this panel our priorities. A governor who leads in our state has made it, she has declared obstetrics as an emergency. If you see a helicopter flying, it's going to pick a mother. If you see a helicopter flying, you just know there's a mother in distress. And she's a lady. Why can't we do this in Africa? You people, I come from Busia. Busia is a district at the border with Kenya. We have gold worth $12 trillion US. And I'm a pauper in America. I have to shove snow this morning if I have to drive the car. But today we can't come out because it's -30. Just be kind to yourself and Google and find out what Iowa is. It feeds the world. They were cutting snow, we were watching. I mean, this lamentation must stop. Africa. We can fix Africa. We can do a lot of things. And if I told you that I'm asking America, since I am the one making this money here, I'm enslaved here, we ask them to account for the taxes that we pay here. I have already filed for taxes here in January. I filed in January because that's what qualifies you to be here. Africa we can fix. We're just talking about reproductive health. Creating human beings to become a problem for us, no way. Well, thank you for giving me an opportunity to lament and to express my
Thank you
anger.
so much. Thank you so much. I have a couple of speakers, but thank you so much for that challenge. What can we do with what we have? I will definitely hand over the microphone to good Dr. Mutunga. Please use 30 seconds, and then after that we'll hear from Ronald. Then I'll hand back to my panel because I want us to be done by 6:30.
Thank you so much. Thank you so much, everybody. And I've just joined in late, so I don't know what has been discussed already, but I had proposed to be a part of this conversation, and I'm glad I've been able to catch it. Right now, blame games and where have we been the entire time, blah, 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 may not really solve what is at hand. So we need to wake up to the reality of this. It's sad. The Global Gag Rule creates so many barriers for people, especially now like low and middle income countries like ours, where access to SRHR services is still very, very minimal. The Global Gag Rule cuts down on funding and limits outreach programs that have been utilizing some of these funds to reach those people that are deep in the communities who are not as privileged, to have access in terms of finance and education and awareness for some of the services that really help when it comes to SRHR. But now that what has happened, we need to move on painfully from here. What I was suggesting is we need to encourage. How do we raise funds? By the way, Mungadi was sharing. I keep forgetting his real name. And I see us having a very different community. We don't have the cohesion that other people elsewhere in the world do have. That when tragedy hits, people are able to organize quickly and come up with an emergency fund. They're able to fundraise and come up with things that can solve the local challenges like floods, like catastrophes that occur quickly. So I think it's time we also thought about how can we organize, how can we raise funds, even if on the African continent, how do we tap from the people in the diaspora? Okay, there are people out there who are actually, you go on Instagram and you're going to see people living lavish lives every now and then, meaning if we sold some of these challenges to those people in the diaspora, we could tap into some funding from these sources and encourage local production of things like the pads and other innovations that people have come up with that are helping to strengthen the SRHR alliances in different countries in Africa. And over time, we could be able to solve these challenges. I look at countries like China that have had challenges over a decade and a half or even 2 decades back, and how they've been able to rise up from that. And all I can see is we have a leadership problem, we have an organization problem, and I think if we can solve that and come together as a people, there is a lot we can achieve. And a time will come when we don't have countries that come to us, mine our minerals, depend on us, take our human resource, grow their countries basing on capital that are coming from these underprivileged countries, trying to put us on chokehold with their small handouts and making our people miss out because of differences in ideas. So I think we need to organize ourselves and we need to free ourselves of reliance on freebies, having to beg every time. Thank you so much. Back to you.
Thank you so much, Godfrey. That was very self-explanatory. Real quick, Ronald, Hopvine, and then I'll hand over to the panelist in 5 seconds, if you may. Thank you so much.
Thank you so much, everyone. Good morning, good afternoon, good evening. Mine is a quick one. I would just want us to think about engaging the local communities, the informal groups, who are at the same time perpetrators when it comes to violations of maternal health issues. So if we could engage the men who are major perpetrators, who are the major sponsors when it comes to, for instance, unsafe abortions in communities, if we could engage them and talk to them about prevention of unintended pregnancies, let's talk to them and make them appreciate the need to prevent something before it happens. That would be a very good milestone for us. Now that we are faced with our financial constraints here and there, I think is a very good move to engage community fundraising drives locally here, like the Muno Mukabis of Voice and everywhere. It can help a lot. Thank you so much.
Thank you so much, Ronald, for those brilliant ideas. Hope Fine in a microsecond, please.
Yes, good morning, good evening, and good afternoon to all the listeners. Thank you so much for the opportunity. Just like you've given me some few seconds, I want to say one thing, that reproductive health is not just a privilege, but it is a right of every individual of reproductive age. That is one. Then concerning what is on the ground or what is at hand now, we need only one thing. We need to change the mindset of our community from being dependent into being self-reliant. And this must begin with an individual. I'm going to give you an example. As Hope Vineyard Foundation, we have set up a campaign on global giving. And of late, I spoke to some of my friends and colleagues. I was like, do you know what? You can just donate some $10 only to our project. The person was like, I'm also surviving on donors' money because he's working with an NGO also. So you can imagine such kind of mindset that we have. It is not that we do not have, but not until we first shift our mind from being dependent on the external, from being dependent on the people that are outside Africa, then it will be hard for us to tackle things that will come ahead. Let's assume another pandemic comes again. How are we going to handle if fundings are being cut for us like that? We need to change our mindset. That is all. Thank you so much.
Thank you so much, Hope Vineyard, all the way from Zombo. And I know that this conversation is very interesting, but the good bit is, one, you can be able to re-listen because it's being recorded, but also you can engage using the hashtags, and so that we can keep the conversation flowing. I'm going to start in the order of Nuru, Dr. Henry and Buki. Please give us your closing remarks, because we could talk till the cows come home, but I'm loving the brilliant ideas that have come about, and I'm very hopeful that we will not just be talkers, but we'll be people that will head over in the communities and use our platforms to make a difference. So over to you, Nuru, Dr. Henry and Buki, and then we'll wrap this up. Thank you so much.
Thank you, Faye, and thank you to the listeners. Allow me to start by saying that we should never forget the concept of Ubuntu in Uganda and the world. The issues we are speaking about are issues concerning lives and not emotions. We should think about that. We are dealing with people's lives. We are speaking about lives. And we choose the choices. We make choices on where we want to be and how. So let's not be blindfolded by the things that are happening in the country to start throwing tantrums around Uganda's dependence on aid. But think about conversations around multinational relations and the contracts we keep signing as a country. It did not fall from the sky that America comes in to support Uganda. It did not. So let's have the concept of Ubuntu at the end of our lives, our minds, sorry. That having been said, I wish to state that I know that Uganda is independent and gained its independence on 9th October 1962, but we have had conversations with partners that come in to give a hand into the services we provide. If you have not gone to communities to see how people struggle to see how parents even struggle to find out what information they should be providing that teenager who wakes up in the morning and the penis is erect, then we should not be on the space to have conversations about women and their bodies. In my view, these conversations make us think and reflect and impact on what this means. The whole world has been impacted by Trump's orders. I mean, we are speaking about lives. The day that Trump recalled PEPFAR and USAID, I saw messages of people telling people living with HIV, please run the stop-work orders. Run to this facility before tomorrow. The order starts tomorrow. Get your medication for 6 months. Get your medication for 3 months. We are speaking about lives. Women are dying of unsafe abortions. And I wish to state that we need to do much more. While we are encouraging our government to actually step in and support as much as possible, we should not be, we shouldn't blind our faces to the conversations that have partly stepped out of this space. I end by indicating to the communities that the bodies are ours, the people are us, and we need to fight much more to see that women's rights are respected and lives protected. Thank you so much for listening to me.
Thank you so much, Noor. Over to you, Dr. Henry.
Yeah, thank you, Moronji. Thank you to our listeners for coming up. I'll add a few things on what my brother Godfrey stated about fund diversification, and this is the time that we need to hold our governments accountable. We live with a government that is so lavish, especially with spending. It's very easy for this government to release a supplementary if it's to do with the military or if it's to do with MPs buying cars. But whenever it's to do with health, their contribution to the health budget is so little. So we need to see how our government can increase its contribution to the health sector, and particularly the reproductive health, stroke HIV. Then the other thing I can say at the end could be we need to look at how we can engage our regional bodies, speaking of the African Union, speaking of the East African Community, so we can draft and develop frameworks that promote reproductive justice. Because if you look at our African countries, what they usually do is they look at America and the other superpowers, and then they'll be like, if America says this, or if America says abortion is bad, if America says contraception is bad, then who is Uganda, who is Kenya, who is Tanzania? So we need to focus on what our regional bodies can do, and then we advocate for reproductive justice that works for our people. Recently, we had the sexual reproductive bills in the East African Legislative Assembly, but I remember it faced a lot of resistance. So we need to think about what we can do to make sure such bills are passed in favor of our people as far as reproductive health is concerned. Otherwise, we leave our fate to America, leave our fate to the other countries in the global north. Over to you, Moronji, and thanks to our panelists and the listeners.
Thank you so much, Dr. Buki.
Okay, thank you. Thanks everyone for a great conversation, and thanks to our able moderator. You've done an amazing job. And thanks for the comments. I think that as we think very deeply about this, and I think I agree with what the previous panelist has said, but I also just want to remind us, because there's this feeling that we receiving aid is us only just being beggars and not as a tool for international and foreign relations, right? Because if we look at the global financial architecture, how financing works in the world, how decisions are made, one of the things African governments have been saying, sometimes, they do hit the nail on the head, is they've been talking about the issues of illicit financial flows. And that means the flows of wealth from our countries to the West. And if we look at those illicit financial flows, some can be said to be 72 billion, 82 billion. It's higher than the amount of aid that we receive. And a lot of governments African governments are pushing for a US tax convention. They're pushing for a change so that the money that is made in our countries can actually stay in our countries and can be used to fund basic social services. So that is a fight that is required for all of us to be able to start understanding what these global financing models are and what we're pushing so that our governments can be able to actually retain those funds. I know we can have conversations around corruption and different things like that, but let's at least ensure that the monies that are being made in our countries can actually go to people and deal with those critical issues. And I think that's really important to highlight and should not be lost in this conversation that is happening around aid. I think the other very critical thing as we all try to think about this is that we're going to be challenged to think outside of what we know. For many of us, we grew up in a world where it seemed like the moral arc was bending towards justice. Where we were living in a world where people don't think that it's okay for a protest vote to lead to the deaths of people. Where a man who is racist and has called our countries terrible names, and yet we're here saying that, he's just doing what is in the best interest of the United States. No country is an island. No person is an island. We live in a global interconnected world. So for me, it's quite critical for us to understand that politics, as much as it's global, as much as it's national, and yes, there's national sovereignty, it's also very much local. We don't live in a world anymore when things happen in other parts of the world, it affects us. When the war in Ukraine happened, it affected us. What's going on in Palestine affects us. All of these things matter. And I think it's quite important for us to start thinking in that way, that all of these things, they matter. They're important. And that are really our focus as people of conscience, as people who had elders who fought for our liberation, who did not accept to just be colonized, who did not accept, right, the words that were said about them as uncivilized, as the dark continent, who instead shone light on the hypocrisy of the world. They handed the torch and the legacy to all of us to be able to do the same. So as much as we can be thinking about NGOs, civil society, at the end of the day, those are just structures and institutions. What matters is the fact that we are building on a legacy of people who were able to free nations. And that is so important and that matters. So as we think of our role in this current space, I really do hope we think beyond civil society, we think beyond NGO, but we think about what really matters now. If you were the one who were to stand in the shoes of our freedom fighters, how would you go about it? Because now that is the conversation that we're having. And we have a role to continue to bend that arc towards justice. So you have to speak to what is it that you can do, because you can feel very demoralized. What is it that you can do today? Where is your sphere of influence? Where is your sphere of power? Is it with your family to be able to at least tell them what's going on, to be able to explain so that they're not contributing to the misinformation and disinformation? Is it with your friends to raise money? Organizations like TASO have stepped in the gap and have been providing and continue to provide ARVs. The person from Honey is talking about like what it is they're able to do. People are doing things in their own little spaces, in their sphere of influence. So the baton is back to each of us and everyone on this call. What are you doing with your sphere of influence? Thank you.
Thank you so much, Buki, and Nuru, as well as Dr. Henry, and for every single one of you that has joined into this space. I would be doing it a disservice if I even tried to repeat any of the things that has been elaborately said. Thank you so much for making space and making time. We began all the way at 5 and it is now 21 minutes onto 7 p.m. and I would like to release us, but I would like to encourage us and reiterate, please do give Sehad Uganda a follow and do check out their works, do read their work, support the local NGOs in the work that they're doing. But I also love the fact that they have emphasized personal initiative. You may not get donor funding to to counter misinformation, but do be that person, that coworker, that person in the WhatsApp group that demystifies and make sure that you counter misinformation. Also remember that your health is your priority. Do make smart decisions, make smarter choices, and together I believe that we will be able to defeat this gag rule and whatever repercussions that it may want to have on us as a community. Thank you so much for joining us this evening. Please again do follow the different civil society organizations that are at the helm of ensuring that the work continues. And I'm so grateful that we got to have this conversation. Remember, you can listen to it all over again in case you joined it a bit late. Just make sure that you click on this link after we've closed. Thank you so much. Have a lovely, lovely evening. It's 20 minutes on to 7 p.m. Enjoy your evening, and I hope that the weekend is kind to you. See you, everybody.